So indeed, I had a talk on the patient-reported outcomes. So we now have the chance in multiple sclerosis to have really a panel of new treatments. However, how to measure the benefits on the patients has been discussed. So we use mostly the clinical examination and the EDSS score. But now we realize that it doesn't really represent everything that the patient is experiencing and how it really affects his own life. So it's why more and more in clinical study we have to include the voice of the patient, and those pros are one way of doing it. Of course, it opens many challenges because the patient does not always focus on the same topic as the medical doctor. So we really have to have something standardized, also where the patient can participate to the elaboration of those questionnaires, and that it really represents what they are living every day. So I discussed the challenges that it was to implement it in the clinical routine. So we are getting there, but we have many progress to do now on the long run. Of course, I think one of the strategies is really to implement the patient also in elaborating those questionnaires, and also to use new tools, for example, electronic tools also. So that would be one way of doing it, and validating it in studies also, and increasing also to have topic that we could propose to certain persons, that we don't propose everything to everyone, but we could really have specific pros for specific problems that is more important for one person or the other. But there are still many challenges because it's time consuming for the patient, for the clinician. It's also the question of ethical and protection of the data, the database. Those are all new questions that are coming in that we have to answer in the future.